Hi, this is Dr. Billhemmer again from the Tuscola Pain and Wellness Center. Now I'm going to explain about the 5 different types of blood sugar problems that you could experiencing and probably are experiencing right now, so that you'll have a much better understanding where you're at, and as you continue to improve and get better, what you should be expecting. So the first level of blood sugar problems is called carbohydrate intolerance. And this is very common. I see this all of the time, but most people do not seek medical care or advice from a healthcare provider because of this. But this is something that happens, let's say that if you don't eat, you start to get nauseous, or you get shaky if you don't eat. You hear the term hyper or hypoglycemia, things like that. You have sweet cravings. You have problems where your concentration isn't as good. You have trouble sleeping. These are the first signs, and sugar cravings. These are the first signs of what's called carbohydrate intolerance. Once that progresses for even years, you get into the second level of blood sugar problems, which is called insulin resistance. Insulin resistance means that as your blood sugar starts to rise in your bloodstream, your pancreas produces a hormone called insulin to help to carry that blood sugar and open up small channels in your cells so that they can in turn carry blood sugar into the cells to create ATP and give you energy. But what happens over time is as your blood sugar continues to go up and up, so does your insulin level goes up and up. And the biggest problem is that when your insulin levels stay high for a long period of time, those receptors where those insulin molecules insert into the cell begin to downregulate or to get burnt out. And so now those insulin receptors cannot attach that insulin at the degree it could before. And so now it becomes resistant to that insulin, and so now blood sugar stays in your bloodstream longer and causes more inflammation and keeps getting higher and higher and higher. That leads to the third level of blood sugar issues, which is called hyperinsulinism, or advanced diabetes, or advanced insulin resistance. This is when the insulin is just trying everything it can to get higher and higher and higher and shove more blood sugar into the cells and open up those small channels to get that blood sugar into the cells so it can create energy. But what happens is it just gets harder and harder and harder, which leads to the fourth stage of blood sugar issues, which is called syndrome X, or metabolic syndrome. It is usually in hyperinsulinism or in syndrome X and metabolic syndrome that you see a lot of people start to have real bad issues. You start having liver issues. You start having blood sugar. You've already had blood sugar issues, but now you're gaining weight for no reason. You have no energy. You can't sleep. You can't do your normal tasks during the day. You start coming in with a heart disease and other chronic disease processes. It could even lead to cancer and arthritis and all kinds of different problems. And it all due to the fact that your blood sugar is becoming less and less and less stable all the time. Then finally, at the end of this whole process is type 2 diabetes. This is when the insulin, the pancreas just cannot produce the insulin necessary anymore. It has burnt out. The receptors for the cells are now burnt out. So now the only thing that can be done in this step is to start to give drugs from the medical point of view to start to drive more blood sugar into the cells. But I'm here to tell you that is not the be-all end-all. You cannot correct a metabolic problem, which is what this is, with a drug. The only way to correct a metabolic problem is to correct the metabolism in the first place. That's what I do. That's what I've done for years. And that's what I want to do for you. So, when it comes down to all 5 of these levels, you can work your way back, and I have done it for years, helping people go from type 2 diabetes to syndrome X to metabolic syndrome, back into hyperinsulinism, back down to insulin resistance, and all the way back to carbohydrate intolerance, and then all the way back to normal blood sugar. I want you to be my next success story. My name is Dr. Bill Hemmer. Thanks for listening. I'll talk to you soon.